Okay,
I
you'll
just
see.
introduced myself, and I would like you to introduce yourself to the followers.
Sure. Okay. Well, hello, Alicia.
Hi. Hope you're having a
Uh,
great day.
I'm having a great day. You know each other for a long time. We go way back. But yes, I'm a board certified plastic surgeon right here in Coral Springs, Florida. And I have been in practice for almost 32 years. I can't believe it. I started when I was a child. I perform all cosmetic procedures for the face and body. And then I do some reconstructive surgery, but mostly cosmetic these days. And I'm so happy to start working with Alicia because one of the biggest things that patients say all the time is, I don't want the surgery because I don't want a scar. Well, you can't do a surgery without a scar. So as a plastic surgeon, we try to hide scars, minimize scars, do the best job to close incisions so that they will heal as well as possible. But all scars are permanent. However, within a year or 2 years, they fade quite a bit. And this is where Alicia's work comes in because I can revise a scar surgically. I can inject with some cortisone, use lightening treatments, laser treatments. But the scar camouflage that Alicia offers is really a great option for patients that want to try to make their scar look better, as long as they've waited long enough for about 12 months to make sure that it's completely mature.
Oh, he does make a great point. So I do see a lot of clients that will come in after his surgery and they have scars that they're very happy with the procedure, but they want the scars to be hidden. So then we can go ahead and lighten them with my FDA-approved lightening treatment, which is done with a tattoo machine, or we can go ahead and camouflage them with skin color camouflage colors that we actually mix to match your skin tone. And Dr. Levens is correct. You have to wait at least a year for your scars and 2 years for your stretch marks. I have a question for you, Dr. Levens. When we're working on a scar with keloids, do you feel that the camouflage, I know that it helps the color, but do you think that will flatten the skin at all because there's some microneedling involved?
Well, I think the keloids are really, really challenging. There's no question. And the treatment for that is usually surgery plus radiation plus steroid injection. And then once it's removed, if there's still a visible scar, that's when the camouflaging could happen. But the problem is if someone's really sensitive to that, then any kind of little, even micro trauma from needling can stimulate more keloid formation. So that can be challenging.
My scars are from hip to hip, around my new breast, and my port scar, all pinkish.
Okay, so yes, we can go ahead and lighten those scars since they're darker than your skin color. We cannot make them with, we cannot cover them with color because you cannot put color over a dark scar. If it was lighter than your skin, then we can camouflage it. So the first step for you would be to come in and get them lightened with the FDA approved treatment, and that would take 1 to 3 treatments to lighten over about a 3-month period. Okay? I do work on a lot of scars that are darker, and that's where the lightening treatment comes in, and Dr. Levin sends them to me as well for that. Do you have any thing that you want to share with the clients that are following regarding the
Well, actually, I have a question good for you that this is going to be, we're talking about the different colors. So you had mentioned things about different, lighter skin types, Fitzpatrick 1 to 3, darker, 5 to 6. Are there certain challenges? Are you able to treat, pretty much anyone of any color?
So we can treat everyone on the Fitzpatrick scale except for one. When the person has no contrast, the issue is more of a texture issue. It's not really a color issue. So we can treat them with microneedling, and so can Dr. Levin's office with his lasers. But with the actual color, I would stay away from that because it's too light.
Okay, but certainly darker skin patients, I mean, I have a lot of darker skin patients that talk about or think that they might be prone to darker scars, hypertrophic scars. It's certainly not necessarily the case. I have some patients with very light skin that can have bad scars, but it's nice to know that if you have a reddish scar, you can definitely make that look better with time. And then even a darker scar, you can make that look better with time.
Yeah, so hyperpigmented scars and stuff we have to lighten first. But yes, we can work with all different ethnicities. We have Indian, Asian, African American, dark Hispanic, and then we have the palest of the palest. So we can do everyone. I just think that Fitzpatrick A, the light redhead, really no contrast, it does not work well on at all. I suggest microneedling or laser with that one.
Sure, when you do your treatments, you encourage your clients to protect themselves from the sun as well.
Yeah, so I want my clients to come in with their natural skin color because I want to camouflage their natural skin color into the stretch marks or the scars, not the tan skin. So
exactly, yeah. Exactly. We recommend for everyone to use a couple different modalities for their scars. What makes a scar bad is tension. So of course we try to close it as well as possible. We use dissolving sutures, so usually there are no permanent sutures. We place all the sutures below the skin, so there's a nice seam on the skin. And then we use a combination of pressure and silicone. Those are really two key ingredients. And the pressure, we just usually use some plain hypoallergenic paper tape that we start on the scar at a few weeks. And then later on, we recommend silicone products. We happen to like biocorneum, which is a very good silicone product that is sunblock. And there are about a myriad online that you can see.
And what about vitamin C, a high percentage?
Well, I think vitamin C is absolutely good for your skin and also helpful for scars. We have a full service medical spa here with a medical esthetician, and she advocates vitamin C for a lot of our clients for sure.
And so
both oral and topical.
Yeah, so that just actually makes me feel better, because a lot of my clients, I suggest them to use vitamin C on scars that are not matured yet for my services, and I've seen wonderful results. I have them use anything above 20%, and they've been really happy with that. So I'm glad that you're able to clarify.
Excellent. And what I tell patients all the time is that, first of all, you can't exercise away loose skin. You know that. You can't exercise away stretch marks. And one of the best ways to get rid of stretch marks is to cut the skin out and throw it away. But you're not always able to do that. One place where you're definitely able to do that is the abdomen and the lower stomach, especially below the belly button. So you can literally take that whole thing and throw it away on someone that's had pregnancies, massive weight loss, and a lot of loose skin. But the stretch marks that are in the upper abdomen get sort of lowered down to the lower abdomen, and those don't come out because you need some skin to close. So at that point, once you've completely healed, those can be camouflaged by Alicia's type techniques. But absolutely, not everyone. For example, I know a lot of your treatments are on like the buttock area. You can't just cut out the skin on the buttock area. Not every part of the body is amenable to cutting out like that, but it's always a good combination to think about surgical removal and then camouflage.
I do know that I have done a lot of liposuction scars. It needs about 1 to 3 treatments for the lightening and 1 to 2 treatments for the camouflage. A lot of times when I do the lightening on the scars, it lightens enough to the skin color of the person where it's done and they don't need anything else. If I have to camouflage it because it's too light, then they need about 1 to 2 sessions, and it looks really, really nice. So I just wanted to clear that up because a lot of people were asking questions on that.
When you camouflage surgical scars, for example, a long knee scar, how does the camouflaging work to look similar to the skin since it's different skin texture? Does it look like a colored line?
So I'm matching the good skin, not the scar. So I'm matching the color to match your skin. Obviously, you're going to see the rigidness of the scar, but you're not going to see the color. So there won't be as much of a contrast. It will just be a texture issue.
I have white stretch marks on my lower back. Would you recommend stretch mark camouflage?
Yes, so white stretch mark on the lower back is very popular. Many people have them, and yes, it is lighter than your skin. I do recommend it. So I really enjoyed this, Dr. Levens. Do you have any final words that you want to share or say to anyone out there watching?
Just, I appreciate your services, and I think we had, this was a nice little get together, except for the technical difficulties. Now it's time to go see some patients. I'm sure you have some clients too. So anyone can refer questions to you or to me through Instagram.
I really enjoyed speaking with you and you being able to answer the questions that some of my clients were asking.